Hello and welcome. My name is Jordan. I'm a clinical GI physiologist at the Functional Gut Clinic. This is our abstract entitled Excessive Belching in Gastroesophageal Reflux Disease, Supragastric Belching or Small Intestinal Bacterial Overgrowth. Excessive belching is common in patients with GERD, and the main determinant of troublesome belching is thought to be supragastric belching. Now, this is a behavioural phenomenon whereby air is sucked into the esophagus and then rapidly expelled. But belching is also common in SIBO or small intestinal bacterial overgrowth, and this relates to the excessive colonisation of bacteria in the proximal gut, and this can lead to excessive fermentation in the small bowel. And meta-analysis found that proton pump inhibitors, or PPIs, moderately increase the risk of SIBO. So we decided to look at the prevalence of supragastric belching and SIBO in patients with PPI refractory symptoms of reflux who also reported excessive belching. And there was 41 patients who met this criteria, and we determined SIBO by a previous lactulose hydrogen and methane breath test, and we determined supragastric belching by a previous 24-hour pH impedance study. In figure 1, you can see an example of a supragastric belch. This is the classic V waveform seen on the impedance trace, whereby air is sucked in and then quickly expelled. It can often precipitate reflux events, such as this one does here. So our results showed that SIBO was more prevalent than supragastric belching in this cohort. Around half of the patients had SIBO, while around 1 in 5 had supragastric belching. And we wanted to look at the association between these and typical reflux symptoms, those being heartburn and regurgitation. So the reflux symptom association, which can be determined from pH impedance monitoring, shows the correlation between reflux events and the patient's symptoms. And we showed that SIBO was independently associated with a positive reflux symptom association for regurgitation. And then we went on to look at the gas production during lactulose breath test, and those with a positive reflux symptom association for regurgitation produced significantly more hydrogen on the lactulose breath test. And you can see in figure 2 at the top is those with positive reflux symptom association for regurgitation, and those underneath is for those who reported regurgitation but didn't have a positive symptom association. And you can see the gas production is significantly more in those with a positive association, specifically in the first 90 minutes, which corresponds to the small bowel. And we think that excessive fermentation may be contributing to belching as well as symptoms of regurgitation. So in conclusion, SIBO is more common than supragastric belching in patients with GERD. And we think there is a relationship between SIBO and refractory symptoms, specifically regurgitation. But this was only a small cohort of patients, and further research is required to look at the relationship between SIBO and gastroesophageal reflux disease. Thanks for taking the time to view our presentation. If you have any questions or want to follow up, you can contact me and Jordan at functionalgutdiagnostics.com. Thank you.